Hello, my name is Ricardo. I'm often asked to explain what Inia MindCheck is and what it does. So I'll do this now in this video. To start, Inia MindCheck helps companies and governments improve mental health and resilience of their people. And how do we do that? Let me tell you a story. This is Jane. Jane works in accounting. She has a loving husband and a beautiful son. Her life seems perfect, but it isn't. Jane's husband, Bob, is unemployed. He lost his job to the massive retrenchment generated by the coronavirus pandemic. Bob seems down and sluggish at home most of the time. He has been trying to get a new job for months now, but just can't get it. His self-worth is all the way down. Bob always puts on a happy, energetic face when talking with acquaintances, but he just can't fool his wife. Jane is concerned about her husband. She's also concerned about her own job, as the economy is not doing well. Their finances are already overstretched. They can barely pay for the basics. On top of that, Jane is also worried about herself and her loved ones contracting COVID-19. Her auntie has been intubated and nearly died of it. Jane also knew people who didn't recover and perished. With all those worries, Jane is constantly tense. For months now, she seems to be using a lot of nervous energy and oftentimes feels overwhelmed by it all. The other night, she woke up sweating, shaking with a shallow breathing, rapid heart rate, and a fuzzy mind. She thought she was going to die. At work, Jane tries her best. However, her energy and focus don't last that long anymore. She has been needing a few extra days off to recover her energy and bring herself back together. She often gets those by claiming she has migraine or a stomach problem or feels that she's getting a bug. Jane's son, Eric, can feel something serious is happening with his parents. They're often on the edge and don't have any patience. Eric doesn't know how to process it all. His concentration and behavior has been worsening both at home and in school. This story is more common than you can imagine. In it, it's likely that Jane is developing anxiety problems and Bob depression. Their son Eric also suffers as he needs healthy parents to care for him. Before coronavirus, about 20% of all people suffered from mental health problems every year. During the current situation, we are seeing numbers much greater than that. Anxiety and depression cost the economy over $1 trillion annually in productivity alone. And this number is even before the current pandemic. A recent study in Malaysia indicated symptoms of depression, anxiety, and stress to be affecting about 1/3 of the urban population. If Jane and Bob's symptoms don't get addressed quickly, they can lead to burnout, a variety of anxiety disorders, major depressive disorder, alcohol or drug abuse, a variety of other health problems such as obesity, heart problems, lower immune response, and ultimately to suicide. In the personal realm, this means years of suffering for the people involved. In the organizational realm, this means lower productivity, absenteeism, presenteeism, and high employee turnover. In the public realm, this means astronomical public health costs. Luckily, Inia MindCheck can help. Let's go back to the story. Jane encounters a link or QR code to the MindCheck test via a MindCheck campaign that her organization is running. She follows it and takes the tests, always frictionlessly and anonymously. Her privacy is guaranteed by MindCheck. Jane is presented with an enlightening report of her mental health condition. She can finally understand what's going on with her mind. She also realizes there is light at the end of the tunnel. Mental health problems such as depression, anxiety, and stress are highly treatable when done right. MindCheck's exclusive contributing factors questionnaire shows her what, in her specific situation, is possibly generating or aggravating mental distress. In her case, it might be insecure future, financial issues, having material values or the use of social media, having insufficient exercise in her life, insufficient sleep, and any one of the 19 evidence-based contributing factors that we measure in MindCheck. MindCheck also informs her and guides her on what to do about each one of those. MindCheck shows her curated, localized information, resources, and services that can help her address the problem. This includes celebrity videos, TED Talks, apps and services from reliable sources. We have an online community with mental health first aiders and psychologists. We link to government resources, NGOs, and the employee assistance program if the organization has one. We also have partners who can provide counselors and psychologists for your people. Jane can finally address the issue with clarity, motivation, and empowerment. Jane's organization can also help. With the MindCheck campaign, they will get aggregated anonymous reports to understand which contributing factors are affecting their people the most, and consequently create initiatives and policies to address them for all employees in the organization. That is earning complete privacy for the individual. With that push and accessible resources, Jane takes a few steps. She engages with the MindCheck community or a linked NGO and expresses what she has been feeling. Counselors and the community support help her process her situation and make sense of it all. This is greatly assisted by the insights that Jane already had from seeing her MindCheck report and resource hub. She also starts to exercise a few times per week, walking in nature for 1 hour while listening to audiobooks. The exercise helps increase mental resilience by the release of important endorphins. She also understands via MindCheck that being in natural environments improves mental health. She also decides to download and use a guided meditation app recommended by MindCheck. The app helps her learn and stay engaged in meditation in a consistent manner. Jane remembers reading in MindCheck that meditation helps reduce the need for external validation and may reduce her detrimental use of social media. After a few months, by following MindCheck's guidance, Jane comes back and takes another test. Her report shows a much improved mental wellness state. Her anxiety and stress are not high anymore. She has been feeling much better indeed. She also had shown MindCheck to her husband, Bob. By using MindCheck, Bob understood that he might have been developing depression. He followed MindCheck's guidance and sought the opinion of his medical doctor. His doctor told him to see a psychologist and to exercise. Bob followed the advice, motivated by both MindCheck and his doctor. Bob also used the links in MindCheck to learn how to build a better resume and seek help from an employability NGO. After a few months, Bob feels much better. With much of his energy and self-worth back, Bob has been progressing well in job interviews and is shortlisted for 2 opportunities. He suddenly gets a call from a number he doesn't know. It is one of his potential employers, and he got the job. And thus, their lives get back on track. Eric, by the way, is much better now that his parents are not in a compromised mental health state. So Inia MindCheck makes it easy and affordable to implement mental health strategies that work. It addresses burnout, disengagement, stress, anxiety, depression, and the contributing factors responsible for mental health in a bottom-up and top-down manner. MindCheck has been designed and created by award-winning HR executives and consultants alongside psychologists, researchers, and successful entrepreneurs to enable more compassionate, empowered, and mentally healthy people and workplaces. All founders have personally battled and overcame issues with mental distress in the past, having lived both in the personal sense as well as in the organizational sense. Additionally, MindCheck has been designed from the ground up for privacy. Every single result is taken anonymously for the users. We don't even record the individual's identity with the results. The results, in the case of an organizational campaign, is recorded against the campaign, not the individual. So there is no way their privacy can be compromised. MindCheck is also a registered social enterprise, and all our revenues are directed towards supporting social impact. We have already helped over 220,000 people in the world. We have about 10,000 people every month using MindCheck services. And that's it. If you are interested to know a little bit more about Inia MindCheck and how we can help you make a difference, send us an email and let's chat. Thank you.